Education, Dr. Ron Grabowski.
Thank you, Jessica, and good evening, everybody. This is always an exciting topic. As being a former athlete, one of the things that more or less interested me being was to enhance my performance, and if I do get injured, what can I do to enhance my healing process? And a lot of patients come to my practice, and that's what I ask is, if I get injured, speed up my healing time so I can my event. I'm going to show you a few statistics because we talk about sports nutrition. We think about the adult athlete, or we think about maybe the professional athlete or the college athlete, but we don't think about the person that is exercising 4 or 5 times a week at home to stay in shape or enhance their cardiovascular. But you can see here that even in a impact sport like swimming, that we have quite a few injuries. And when you look at this, you see that here's another sport, of course, in baseball, where we see quite a few injuries as well. And once again, we have to enhance all of these injuries in regards from a healing standpoint. And a lot of times when people get injured, the first thing they think about, do I put heat, do I put cold, what should I do, should I wrap it? And they might even recommended vitamin C with this particular injury. But the point is that there's more things involved than just vitamin C to enhance. There's more things involved than just vitamin C to enhance healing. And that's one of the things I emphasize tonight, is that there's numerous nutrients that play a role in the healing process. And I'm going to go through the healing process, and this is true with every injury, or if a person is going through surgery, and after surgery, how do they go through the healing? And you can see here, worldwide, there's injuries on a regular basis. And this is something that I think is very important to our patients today. And if you have children that are playing sports and they get injured, that hopefully this will help you as well at home as it will in the office. That we think about when we're talking about injuries is, of course, soft tissue injuries, the muscle, the ligaments, the tendons. And so I'm going to take you through that particular phase of healing. And this is the one that most people really look at, is when you injure yourself, people usually recommend taking an anti-inflammatory, whether it's a prescription or, once again, over-the-counter. Or some people actually recommend natural anti-inflammatories, like vitamin C is one. And that when we injure ourselves, that there's a time period that we look at to really decrease the inflammatory process. Unless we have an exacerbation, that normal inflammatory phases should go approximately 10 days. But once again, if you keep irritating an area, it's going to make this extended. One thing I want to emphasize before I move on is you have to complete this phase if you are going to complete the healing process. And this is when patients come into my office, and I emphasize to them, we have to stop this inflammation. And what they have done is, if you don't stop this inflammation, you will never complete the healing process. And of course, if we can't complete that, then the person will go on with, of course, a chronic inflammatory process. So then let's talk about tissue repair. We heal with collagen, and we also heal with elastin, but collagen is our major structure that we look at, and as you all know, is a triple helix structure. So it's like taking 3 pieces of string, twisting them, and as we do that, of course, we strengthen that particular structure. And that's why if you look at a rope is not just straight fibers, it's twisted fibers, and the twisting of those fibers actually make it stronger. And we're going to talk about some cross links and how cross links actually make this stronger. So you can see here that we start to actually make this tissue 48 hours after we have an injury, and it can go up to approximately 6 weeks in regards to the production of this or the deposition of this. Now, this can be other pathology. For example, talk about diabetics. and how it takes longer for a diabetic to heal than a person that's not diabetic. So this is more or less outline showing you that collagen is a triple helix structure. It's cross-linking, which means little bars between. Depending upon what area of the body you're talking about, we have anywhere from 13 to 15 different types of collagen in our body. And it all depends upon where that is, whether it's like the liver, or whether it's skeletal muscle, or whether it's heart, or what other tissues. And that's a little controversial as far as if it's 15 or if it's 13, but we know for sure that there's 13 types. And we also know that when we have a situation where we increase stress on that area, that the collagen will function of stress, which is very important to remember, because if we are going to work with the healing of, say, a neck injury, is we want to make sure that that collagen, it goes in every direction that we're going to use that neck, whether it's flexion, extension, rotation, lateral flexion, all of that. We also heal with elastin, and you can see here that this is the most insoluble protein in the body. And this is this structure product that actually gives us elasticity to our healing. And you can see that it can go several weeks in regards to where we get to the amount of elastin that we need to really say we've completed that healing. So even though a person says, my pain's gone, I can go back and even though they feel that the pain is gone, it doesn't mean that they have completely healed, that this healing process continues on at a microscopic level. And this is why when people go back too early, that they have an exacerbation or they re-injure that particular area. And it also depends upon the nutritional status. What's interesting, as I mentioned earlier, is that people often recommend vitamin C for healing. Well, you can see here that if you take a large amount of vitamin C, that you can actually reduce the elastin accumulation, and that's what we do not want to do. So there is a lot more to healing than just vitamin C. The last phase is the remodeling phase. This is where the athlete is stretching and area so we can more or less rehab that particular area. But once again, they will only add additional collagen if you have the ingredients to do that. Emphasize. I always tell every one of my patients that healing of an injury is both physical rehab and biochemical rehab. That you can't do just one to expect the process. So here's a picture, or what would look like a picture of collagen to some degree, where we have this triple helix structure. But if you can imagine now that there's little bars in between each of those colored fibers, and that's the cross-linking. And the more cross-linking we have, the stronger the healing. Everybody talks about adding protein when you get. This is the reason why, is because you can see here that if you deficiency, you will have decreased functions of the healing process. Your collagen synthesis will be decreased, your proteoglycan synthesis will be decreased, your lymphocyte response will be decreased, and so on. On the right-hand column, you will see that if you have decreased protein, that you will have increased edema, you will have extension of the inflammatory process phase, you will have the overall length of healing extended, and of course other like muscle tissue and visceral tissue, connective tissue will be broken down because of this protein deficit. The healing process that we have to administer adequate protein. Now, just to give an example, that when you, if you're an adult, if you have a certain injury, that you're going to have to go above the normal protein requirement. The normal protein requirement is 0.8 grams per kilogram. And for those of you that can't remember about how to convert pounds to kilograms, is you take your pounds, you divide it by 2.2, and that will give you kilograms. And then you would take 0.8 if you just want to maintain your normal protein turnover. But when you get injured, you actually have to increase your protein intake. So that's when you go to like 1.2, 1.5, or even higher than that to accelerate the healing process. 2 to 2.5 grams per kilogram. But what the point is, though, that this is the reason why people do increase their protein intake immediately, and I mean immediately after an injury. One of the nutrients that's not talked about much in the healing process is thiamine, and we're going to go through various nutrients, like I said, that may not be very familiar to you in regards to the healing process. When people think about thiamine, they usually think about cardiovascular or neurological deficits, and they often think about carbohydrates, and the intake of carbohydrates, you require more thiamine. Well, this is a good point. So here's a person that is carbohydrate loading. They're taking in a lot of carbohydrates, and they're actually, as a result, if they don't keep up with it, or if they don't know if their thiamine status is adequate, you can see that several processes in the production of collagen are affected. And one of them that's very interesting, I think, is the top bullet, where it says that the wound strength can be as much as 55% of normal, so 45% deficit of normal healing tissue, which means that, let's just round it off to 50%, that if you had a thiamine deficiency and you did not take care of it, that the best that you could heal, even with the best physical rehab, would be 50% of your potential. Now, that should make you think, well, to another injury. So this is why we hear these athletes saying, oh, you have this chronic ankle injury, or I have this chronic knee injury, or this chronic shoulder injury. It's because they're not rehabbing properly. They're not rehabbing physically properly and or biochemically properly. Now, what could predispose us to thiamine deficiency? Diuretics. Prescription diuretics like hydrochlorothiazide, or a diuretic like caffeine or alcohol. This is one of the reasons why, if athletes are consuming a lot of caffeine or alcohol in between their training, that they may actually cause a diuresis of this particular nutrient and, of course, affect their wound healing. And if you go into the literature, it clearly says that if you drink alcohol, you are going to affect your healing process, and this is one of the nutrients. You know that B2 is very important for the production of glutathione, and we're going to talk about antioxidants here in a little bit. But if you see here, one of the things I mentioned earlier, that to strengthen the tissue that's going to heal the injury, we want to increase the crosslinks. And the more crosslinks that we have, the stronger the tissue. And if you look down on the fourth bullet, you will see that riboflavin deficiency will cause a decreased amount of elastin and the crosslinks of elastin by as much as possibly 50 to 60%. So once again, the best you will be able to heal is about 50% if you have a riboflavin deficiency. Now, I've been doing this 33 years, and I just look at somebody and say that, oh yeah, you're riboflavin deficient. And we're going to talk about testing and why it's important that we really do objective testing rather than just say, oh yeah, why don't you just take a B complex and cover these, because it's more involved than that. Every one of us has a different biochemistry. So I may need 50 milligrams of riboflavin to maintain my riboflavin status, and one of you out there in the audience may need 75, and another one of you may need 100. We don't know until we actually test. We know that exercise, especially heavy exercise, is very stressful on the body, that we can affect the adrenal glands. And one of the nutrients that's associated with the adrenal glands is pantothenic acid, or also known as B5. You will see this, excuse me, that this is going to come up a lot. And I'm going to show you some case studies at the very end of this when people exercise heavily. And a lot of times people walk around and say, well, I have a 5% body fat, I feel good, and I exercise 5 days a week or 6 days a week. But what they don't realize is there's some underlying deficiencies that are eventually going to catch up with them. And there's a condition known as overtraining syndrome. And maybe some of you or all of you are familiar with it, but once again, we know it happens. So once again, you can see that if you have a B5 deficiency, that the wound strength of the tissue that you are developing with the B5 deficiency can be decreased by approximately 50%. And so once again, we're seeing that the B vitamins are very important. B6, once again, you can see that it affects the collagen and it affects homocysteine. Now, what about homocysteine protein. When we talk about homocysteine, most people talk about homocysteine as a cardiovascular or a stroke risk marker. But in the healing process, this is very important, especially for bone. We know that if people have an elevated homocysteine and they've suffered a fracture, that the fracture will not heal as well with the elevated homocysteine. And what the proposed mechanism is that the homocysteine actually interferes with normal collagen synthesis. So once again, measuring the homocysteine in an athlete will help determine if they can help make collagen. See here that B6 deficiency has been associated with decreased collagen and elastin cross-links. And once again, that's the stability of the structure. And that's something you want to keep in mind when you're talking about strength. Folic acid, same thing. Elevated homocysteine, impaired wound healing. And so now we're looking at this differently. Like I said, there's a lot of literature out there on homocysteine and stroke incidences and homocysteine and cardiovascular events. So if we even push that aside, in this case with an athlete, we want to know, do you have an elevated homocysteine, and how is that going to affect your healing process? And my question to you out there is, are you measuring homocysteine on your athletes once they get injured? Or do you, I always like to tell any one of my patients, it's better to prepare yourself prior to an injury. It's just like if a woman wants to get pregnant, don't wait till you get pregnant and then do good nutrition. You want to perform good nutritional habits prior to pregnancy. So the same thing is true. Don't wait till you get injured and say, oh, I better do something about that injury and take more zinc or take more B vitamins. Let's make sure that you're adequate in all of those nutrients to assure that when you do get injured, if you do get injured, that you are going to heal at a proper rate. Now, we've seen this with B12. B12 has been shown to affect our skeletal tissue just like our soft tissue. So once again with B12 deficiency, and a lot of people, once again, have shown in the literature that alkaline phosphatase, and I apologize for the improper typing error there, but it should be phosphatase, not phosphate activity. So this is something that a lot of people measure. They measure that enzyme to see if there's going to be a callus formation when someone fractures a particular bone. And we expect this to go up if the callus is being formed. If it's not, then of course it's decreased. And so we know that, once again, B12 will have that effect. An injury, of course, is vitamin C. If you get injured, take vitamin C. Well, why should we take vitamin C if we get injured? Well, a couple reasons. One, it's an anti-inflammatory, natural anti-inflammatory. And two, it helps make collagen. But there's an additional effect. As we know, when we injure a tissue, that we release histamine. And if histamine gets elevated for too long a period, it actually impairs our healing process. So vitamin C also has antihistaminic effects. The other thing is, of course, it's an antioxidant. And whenever we damage tissue, we release or produce more free radicals. And we have to quench those free radicals in order for us to decrease our damage. But on the other hand, if we take too much vitamin C, we may actually, again, we're affecting one of the major tissues that's going to be involved with healing. So once again, hopefully, when I get done with this webinar this evening, that you'll go back to your practice tomorrow and say, look, I have a patient that comes in with an injury. I can't just give them vitamin C. There are too many nutrients that play a role in the healing process. And it's like making a cake. You don't just have one or two ingredients to make a cake. You have several ingredients. And if you take one or two of those ingredients out of that recipe, we know the cake's not going to be made. Well, the same thing is true. You can't make collagen without all the necessary ingredients or nutrients. And all it takes is one missing nutrient Vitamin A is often, I think, feared for the point of toxicity. But if you go into the literature of wound healing, you will see that vitamin A plays a very instrumental role with healing. And you can see once again that this nutrient, when I say vitamin A, I'm talking about retinol. I'm not talking about beta-carotene. But vitamin A has actually been shown to help with the production and the status, the integrity of collagen. And you'll see an important point here in a second on how this comes about. One of the things that's been done in wound healing research is they have damaged tissue in laboratory animals in the deficient state. And for this example, say a vitamin A deficient state. And then they've taken the same structure that they've damaged out of the other side of that. So say it was a supraspinatus tendon that they damaged on one side, and then they take the healthy supraspinatus tendon on the other side. And they more or less check what they call the tensile strength. And what this is it's like grabbing each end of a rope and pulling and seeing how much stress on that rope you would have before it snapped. And that's the tensile strength. And they have found that when vitamin A is deficient, that the tensile strength is someone injures their bicep. And they go through the first phase of healing, so the inflammation is reduced or resolved. And now you are putting collagen and elastin into the area. Well, if you're not making good cross-links in those structures, the patient may be able to do a 5-pound curl, no problem. They may even be able to do a 10-pound curl. But if you put them under a stress of, say, a 15 or 20-pound weight, that their injured area now may not be able to take that stress because their tensile strength is not there. And as a result, they re-injure that bicep. So this is why it's so important to biochemically rehab our patients, is we have to make sure that all the assure that the collagen, the elastin, the proteoglycans, and the cross-links are present in large enough amounts. Now, we know that corticosteroids can be used for an injury. And they've shown that vitamin A actually can affect the abnormal effects of steroids. That we know that, once again, that these steroids, even though they stop the inflammation, they actually may affect the quality of the healing tissue. Where on the other hand, vitamin A may actually affect this to the positive note, that if we supplement with vitamin A, or we have an athlete that has adequate vitamin A, that we can actually in injuries. It also can be detrimental to an athlete in regards to the healing process. Now, when you talk about vitamin A, you have to talk about zinc, because zinc actually makes a protein that carries vitamin A throughout the body. And zinc, just like vitamin C, has been used for years in the healing process. In fact, there's supplements out there, I'm sure all of you are aware, that they just have zinc and vitamin C. And they say this is a healing product for enhancing soft tissue injuries. Well, they're right to some degree that zinc is important and vitamin C is important, but what about the B vitamins? They're not in there, and so once again, if a patient / athlete is deficient in a B vitamin, they're going to have problems healing. Why? Once again, we have to quench the free radicals, and this is one of them. And this is why you start to see some deficiencies with these as an injury occurs. Once again, it affects collagen formation, and you can see it also has antihistaminic effects and also affects the inflammatory process by inhibiting the leukotrienes that are released. Copper. One of the things that I think is a very misleading statement or usage of copper is when people say don't take copper in a supplement because it's an inflammatory mediator. Well, on the other hand, you have to look at it that from the time that collagen is formed, which is sometimes that we need copper, because copper not only helps make collagen, but it also helps make elastin. And it doesn't just make collagen elastin, but it also makes collagen crosslinks and elastin crosslinks. So copper is essential for the healing of tissue, whether it's tendons, ligaments, muscle, or even bone. And once again, I see so many products out there that do not have copper in them. And if you don't have copper and you only have zinc, you can actually cause a copper deficiency with taking zinc. And that's something to keep in mind, and I think it's very, very important. So we want to keep it in balance. And usually the ratio that we look for is a 10. Given 25 milligrams of zinc, you want to give 2.5 milligrams of copper. Manganese. Manganese is a mineral that usually isn't talked about much. It's not as popular, of course, as others like calcium and iron and magnesium, but very important here in soft tissue healing. Manganese makes products called proteoglycan, and these proteoglycans are very important as a part of the healing process. And if you can imagine when you were back in school, whether it's high school or college or postgraduate school, that if you remember what a test tube brush looks like, that used to clean out the test tubes, that's kind of what manganese brush is, the ability to hold water. And once again, if you don't have those structures, you can't imbibe water into that area. And once again, it affects the quality of tissue. And manganese is very important for that. They've shown even in cases of fractures that if you have a manganese deficiency, and only a manganese deficiency, that you won't heal well in regards to skeletal tissue, besides the soft tissue that we've talked about earlier. Now, let's talk about exercise in the immune system, because this is a very important thing. In fact, I was talking to a patient yesterday, and he came in, a high school athlete that came in with his mother. And as I was talking to him and his middle of the season or at the end of the season, I said, well, what's happening with your son is he's going through this overtraining syndrome. And we know that exercise can enhance the immune system, but we also know that it can be detrimental to the immune system. And I'm going to show you a few slides here from various individuals out there that have done research and show kind of how the immune system works with exercise. Now, I want you to think about this before I move on to another slide, is that this only really occurs, though, if you have good nutritional status. So if you have poor nutritional status, the athlete will not go through this process. And that's very important to keep in mind. So your immune system. If you look here at the top of this, you'll see that it says inactivity to the left, and of course the middle, the green, says regular training, then the far right is competitive overtraining. And then the line there, the black line, is actually indicating your frequency or tendency or risk, more or less, of getting an upper respiratory tract infection. If you see that, if you have inactivity, that you have a moderate risk of getting an upper respiratory tract infection. If you exercise at a medium status, that you actually enhance your immune system and you decrease your risk of upper respiratory tract infections. But if you overtrain, you can see that you drastically, and they've shown that just vitamin C alone can affect how a marathon athlete gets sick, or the frequency that they get sick. There's another hypothesis known as the inverted J hypothesis, and what this really shows is you can see the blue line talks about immune function. The red line is the disease susceptibility. And as a result, you can see that as you increase your exercise to a moderate level, that you decrease your disease susceptibility and your immune function improves. On the other hand, if you overtrain, the J hypothesis that we're talking about, or the inverted J hypothesis, that they're more or less saying the same thing, that regular exercise is beneficial for the immune system. Heavy exercise can cause overtraining syndrome. Now, we can prevent the overtraining syndrome with good nutrition. But most athletes out there, if they're not well-versed in nutrition, don't know that. And so, once again, they just accept that, oh yeah, every mid-season or at the end of every season, I'm going to get sick. Here's another study that was done with some elderly women, once again, upper respiratory tract infections. You can see if they were highly if they're a walking group, you can see it was a little higher. And if they were sedentary, you can see that they had a significant increased incidence of upper respiratory tract infections. So we know that exercise is beneficial, but can you get to the point where you really are detrimental? And the answer, of course, to that is yes. So you have to have that nutritional status to enhance your immune system. If you lack that nutritional status, you're going to get into the overtraining syndrome. What can affect our immune system? Now, one of the things that, and this has been coming out more in the literature, is when we exercise heavily, we actually can permeate the GI tract without nonsteroidal anti-inflammatories. Just heavy exercise, we can increase our gut permeability. And if that happens, we know that there's going to be some inflammatory mediators that go into our immune system, whether it's the lymphatic system or the bloodstream, and put us in a situation, compromise our immune system, that may set us up for an infection, or an infection after surgery, or an autoimmune disease, or some other conditions. And there are various things that we're looking at or have been experimented with to show products definitely play a role in preventing intestinal permeability. And so this is one thing that right from the first day I meet an athlete, I tell them, I am going to put you on a probiotic, or if they're on a probiotic, to stay on the probiotic. Now there's other things that have been tested. They've looked at colostrum from cows and how that has a benefit. They've looked at goat's milk, and some of the products in goat's milk also have a beneficial effect to the GI tract. But the point is that there's something that we have to do and consider besides our muscles and our bones with exercise, and that is our gastrointestinal tract. And this is why you can see that he or she is getting into overtraining syndrome in the middle of the season. They get a respiratory infection. They go to your office or another doctor's office, and the doctor says, well, I think it's a bacterial infection. I'm going to give you an antibiotic. And whether it is a bacterial infection or whether it's a viral infection, they may get, of course, the antibiotic if they think it's a bacterial infection. So now we're going to disrupt the normal flora. And the normal flora is trying to keep this athlete from leaky gut syndrome. But now we're enhancing that leaky gut syndrome by killing off the normal flora by the antibiotic. Secondly, oh, by the way, you have an injury too, I'm going to give you an NSAID. So now you give this athlete things that you've done to this athlete. One, not only have you affected their immune system by giving them the antibiotic, it may help with the bacterial infection, say in the sinus, but once again has affected the GI tract. And two, you've affected the GI tract by, once again, the NSAIDs. So the point is, there's something else that needs to be considered, and that's through walling off or healing the GI tract. So in addition to the probiotic with the antibiotics to more or less prevent that from happening, we know glutamine. Now glutamine is used a lot prior to injuries. A lot of athletes out there know that glutamine acid is in muscle and skeletal muscle. And so the point is that glutamine should always be considered with athletes. Creatine has been talked about for years. But this is a nutrient that I think is essential for the athlete for two main reasons. One, we recover well when glutamine is replaced as far as skeletal muscle recovery. Two, glutamine helps heal the GI tract. So now you prevent that athlete from getting leaky gut syndrome. At the same time, you are recovering their skeletal muscle, and they can go back and exercise, and you can prevent that syndrome called over. Probiotic should be used on a regular basis with athletes. There was a study done a couple of years ago with children, and they found that if they gave these children probiotic on a daily basis, no vitamins, no minerals, just a probiotic, that they decreased their upper respiratory infections by almost 65%, just by a probiotic. And so it makes a lot of sense to take a probiotic, and there's a lot of different probiotics out there, but the point is that we know we have to do something with the gastrointestinal tract when we exercise. So what happens, and how do we deplete glutamine? Well, one of the ways we do it is put the body under stress. So here's an athlete. He or she's exercising hard. They fracture a bone. They go into surgery. They get surgical intervention. They go to the best surgeon out there. And the surgeon may say, okay, I did great surgery on you. Good luck. Goodbye, we're going to put you in rehab. Well, wait a minute. What kind of rehab? Most often, it's physical rehab. It's not biochemical rehab. It's physical. Nutrition isn't usually discussed. I know I've had surgery on my shoulder, and even though I had a great surgeon, he didn't mention one thing about nutrition when I was injured. And thank goodness I have a background in nutrition. I knew that was getting certain nutrients that are going to affect the performance of an athlete and the healing. Now think about this. For those of you that deal with professional athletes, and I'm going to take the NFL for example, the average career of an NFL player, I think, is like 3.8 years. So let's say 4. And here an athlete gets injured, they don't heal well, and now instead of making 4 years, they make 3 years. But with proper physical rehab and biochemical rehab, you get them back to heal, and now they extend their career. And the example I want to use is what happened when I came back from an ACL injury. And everybody was astonished and said, this guy's a phenomenon. He came back. Well, I will guarantee it that he probably had some help with some nutritional intervention, whether it's eating along with the surgery. I'm sure the surgeon did an excellent job, but there's a lot of good surgeons out there that can heal ACLs. And the point is, what made him different? Might be partially genetics, but it also may be his nutritional status or what he did nutritionally. And so the point is to try to get these individuals into the optimal situation. So once again, know that it definitely has an impact. And this is a great journal. If you're not familiar with this journal, it's one that I recommend that you review from time to time. It's a journal of parenteral and enteral nutrition. And as long as I've been in this profession, this is a journal that I look at on a regular basis, and they have numerous articles on glutamine and the efficacy of this particular nutrient in healing. So let's talk about some cases now. Every one of these cases I'm going to show you tonight has to do with an individual, whether it's a professional athlete or whether it is just an individual that exercises heavily that's not really associated with any organization. Some of them are different, and that's because every one of us has a different biochemistry. But the point is that they have an impact on the healing process. Now, this 35-year-old male, you can see, heavy exercise, as a regular exercise individual, has a B12, folate deficiency, calcium, zinc, and vitamin K. Well, what's a common thing with those nutrients that could affect this athlete? Well, if this athlete fractured a bone, whether it's a stress fracture in his foot or tibia or fibula, whatever the bone, he is compromised right now. He has a deficiency, and he's going to heal at a slower rate. Or if he's still poor, and he may refracture that area, or he may go back too early because of these deficiencies. And the point is, every one of those has been associated with skeletal tissue. Now, not the insulin portion, but the B12, folate, calcium, zinc, and vitamin D. And I showed you earlier how B12 and folate and zinc have been highly associated with connective tissue. So the point is that here's a case of an athlete, and this person has a very low percentage of body fat. So if you looked at him from the outside, you think, boy, this person is in very good shape. And physically, from a standpoint of muscle development and body fat, and these are once again, the results. It shows you the various things. Now I want to show you something here on his graphs because it's very important, and I want to point some things out. One of the things, of course, this is Spectracell laboratory report, and this is the micronutrient test. One of the things that we know that when people are low in vitamin K, that tells us a status of their normal flora. And you can see this particular individual, he is bottomed out. He has a very poor status of vitamin K. Now, in addition to the obvious deficiencies which are highlighted in red, he has some black squares. And these black squares are marginal values. And these have to do with muscle function. Some deficiency can affect the stamina of an athlete, and you can see he is right on the end. So he's right at the point of going into deficient state. So his recovery time, his performance will be affected. And this may mean the difference between a winning of the race or taking 10th place in a race, that his stamina may be affected, not because of his training regimen, but because of his biochemical regimen. And once again, we have to keep that in mind. Here's a 38-year-old female. Once again, some similar deficiencies, some different. You can see the B12 and folate on a 35-year-old male athlete with the same here, but here she has the B1, she has a B6, and she has a CoQ10 deficiency. I showed you earlier how B1 has an effect on the healing process. I showed you the same thing with B6. Now, this is an interesting one, CoQ10. CoQ10, as you all know, is an antioxidant. It's essential for skeletal muscle. It's essential for cardiac muscle. In fact, it's required by every cell to make ATP. We cannot make ATP without CoQ10. And so this female athlete is compromised for her performance, by having these deficiencies, and also she's setting herself up for poor wound healing or extended wound healing time. And once again, these are her results from a standpoint of the micronutrient test. And you can see, once again, she has some marginal values. Look at this. We talked for further healing problems because of these marginal values. And once again, there is no way that any one of us can look at an athlete or a patient and tell them exactly what's wrong with them by just physical appearance. Here's a 42-year-old female. Once again, you can see different deficiencies, some similar. We saw zinc in one of the other previous slides. We saw CoQ10 in the female athlete that we just talked about, but here's an oleic acid, here's chromium, vitamin D, and alpha-lipoic acid. Antioxidant, antioxidant, antioxidant. Once again, remember, when we exercise, we increase our free radical production. This is showing you that. and it's very important to understand that. Now, she also has some marginal values. The glutathione, as you all know, is a very powerful antioxidant. Selenium is on the edge. She has B2 that's in the yellow, which is marginal, and B2 is required actually to make glutathione. So part of the conversion of cysteine to glutathione is affected by the B2. So once again, very important. And this next case study is, once again, this last case study of the evening is, once again, a 59-year-old female, exercises on a regular basis, and she also has, like I said, some similar different biochemistry. And we can't treat all the patients / athletes the same. We can't say, you injured your ankle, take zinc and vitamin C. Because if they have adequate zinc and if they have adequate vitamin C, that extra vitamin C and zinc may not necessarily enhance their healing. But if they have a deficiency of B12, they have a deficiency of manganese or copper, then we have to make sure we get those nutrients to them. And once again, how do we know that? Because we're going to test them, and we're going to determine what their biochemical need is to enhance their biochemical rehab and to enhance their physical rehab and performance in the future. And once again, 2, 3, 4 years, not only do they get to enjoy what they do, but once again, it's a financial incentive as well because they can return to their activity at a faster time period and know that what they've injured, they can heal at the optimal status with proper nutrition. And once again, these are just the reports showing that summation of the previous slide. So once again, I'll open up for some questions. So, are they just, again, well, to address those questions, this test, the Spectracell micronutrient test, is very comprehensive, and I showed you some deficiencies that are present with these particular individuals that which correlate very well with the scientific literature that will enhance the healing and the performance. And whether you are working with your child through sports or whether you are working with an athlete through your office, I hope that you really take this seriously and show that you can enhance their performance and their healing process through nutrition. And one of the statements that you might have heard me say in previous webinars, and I say this to healthcare professionals all the time, and I also say this to the public when I do lay lectures, is don't give your car gas if it needs oil. And what I mean by that is if your body needs zinc and you give it vitamin C to heal, it's not going to heal. The vitamin C is not going to correct the zinc deficiency. And so I think it's very important that we start to customize our treatments from a nutritional standpoint for athletes or people that are active. And if we don't, people are going for decreased with proper support or what I like to think, preparation. So once again, before you start exercising, see what your nutritional status is. And once that is determined, then you can say, I'm going to take these nutrients to make sure I correct those nutrients to prevent, once again, delayed healing and enhance my performance. And also, as I mentioned earlier, to help prevent the individual from getting sick on a regular basis or missing out on a particular part of the season. And I think the big event. Because that's what we all work for as athletes, is to get to the World Series, the Super Bowl, the Stanley Cup, or whatever. And that's so important to keep in mind. And as a former athlete, I can tell you that it's had an impact in my life, and I see it every day in my practice with athletes, and you can see the same thing with your children or yourself if you exercise on a regular basis, and also your there's always that chance of things like that happening. But this webinar is available. It's archived. You can go back to it anytime. I really think that it's important that you realize that there's more nutrients to healing than just the standard vitamin C and zinc that most people push, and that we need to really customize our particular therapies with these. Just like you customize a Spectracell, and they will forward them on to me, or some other individual at Spectracell may be able to answer the questions. Thank you very much, and good night.
Thank you, Dr. Grabowski. That was very informative. Remember, you can always contact your Spectracell representative or email your questions to webinar@spectracell.com. As a reminder, you will receive an email with a link to the recorded webinar. Thank you and good night.